Hi, in this video we're going to talk about each ABG situation, its causes, and its treatment. Let's get started. We're going to start off by talking about respiratory acidosis. What causes respiratory acidosis is hypoventilation. In other words, a person is breathing too slowly or their breaths are too shallow, and so you're going to have a retention of carbon dioxide. So hypoventilation would look like being oversedated, it would look like having COPD or any other condition in which air is trapped and you have an increase in the level of carbon dioxide within your system. You could also have respiratory failure or respiratory arrest. And pulmonary edema, just to name a few. Carbon dioxide, think of carbon dioxide as an acid. So if you have higher than normal levels of carbon dioxide, that puts us in a state of acidosis. Alternatively, if you have lower than normal bicarb, that puts us in a state of acidosis as well. But this would be more applicable to metabolic acidosis. So then how are we going to treat this? So to treat respiratory acidosis, you need to treat the underlying cause. So this would look like giving someone who's experiencing COPD bronchodilators to open up their airways, giving them corticosteroids to reduce the inflammation, to increase the ventilation, improve their oxygenation, and help bring down the levels of CO2. Another way we can treat respiratory acidosis is to increase the number of respirations. Because remember, the cause of respiratory acidosis is hypoventilating. A person isn't breathing enough. So we need to increase their breathing rate. And another really simple thing that can be done is to elevate the head of the bed, because this promotes oxygenation. Now let's move on to talking about respiratory alkalosis. With respiratory alkalosis, the cause is going to be hyperventilation. So what's happening here is that a person is breathing too much. And so this excessive respiration is going to decrease the amount of CO2 because they're breathing so fast that they're essentially blowing off the levels of carbon dioxide. And remember, think of carbon dioxide as an acid. If you have higher than normal, that puts us in a state of acidosis. If you have lower than normal, which is what is going to be present with respiratory alkalosis, that's going to put us in a state of alkalosis. So a person hyperventilating, meaning they're breathing more than normal, could be due to them being in pain. If they're anxious, or if they have a condition such as pneumothorax, which increases their respiration. So what we're going to do to treat respiratory alkalosis is we need to treat the underlying cause. So let's say someone is hyperventilating to the point that it's put them in a state of respiratory alkalosis. And we know that this hyperventilation is due to pain. So by treating the underlying cause of pain, giving them pain medicine, that's going to help bring down their respirations to normal. By bringing their respirations back to normal, this is going to help stabilize them and take them out of respiratory alkalosis. Another thing we can do to help treat respiratory alkalosis is to reduce the number of respirations. And this makes sense because with respiratory alkalosis, what is causing it is hyperventilation. A person is breathing so quickly that they are blowing off a lot of carbon dioxide. And if our carbon dioxide levels are lower than normal, that puts us in a state of alkalosis. And so another thing that can be done is by breathing in into a paper bag. And what breathing into a paper bag does is it allows a person to rebreathe the carbon dioxide that they're blowing off. This is going to help increase the level of carbon dioxide within their blood to help stabilize them and remove them from a state of alkalosis. But we don't want them to breathe in too much of the carbon dioxide, because if the carbon dioxide level is greater than normal, that's going to put us in a state of respiratory acidosis. Now let's move on to talk about metabolic acidosis. The cause of metabolic acidosis is going to be either acid gain, or bicarb loss. So let's talk about bicarbonate loss first. Bicarb is lost through the feces. And so in the case of diarrhea, where someone is excessively defecating, they are also excessively losing bicarbonate. And you have to recall that lower levels of bicarbonate, lower than normal levels of bicarbonate, results in acidosis. Because think of bicarb as a base. So if you have lower than normal, it's less basic, it's less alkalotic, and it becomes more acidotic, the situation that we're in. Bicarb loss can also look like bile drainage. You're losing bicarb there as well. And as for acid gain, this is going to look like a person who has kidney failure. The kidneys are responsible for reabsorbing bicarb from the urine. And so if someone has kidney failure or their kidneys are injured and they can't work as efficiently or work as well as they're supposed to, you're going to have a lot of bicarb loss through the urine, putting us in a state of acidosis. Additionally, if someone is in a state of DKA or diabetic ketoacidosis, or if they're in a state of shock, that is also going to increase the amount of acid that is within their blood, putting them in a state of metabolic acidosis. So then for the treatment, you of course want to address the underlying issue. So let's say someone is in the state of metabolic acidosis, and the cause is DKA, diabetic ketoacidosis. So by treating DKA with fluids, and insulin, that's going to help stabilize the patient and remove them from a state of acidosis, metabolic acidosis. So now let's talk about metabolic alkalosis. With metabolic alkalosis, you are losing acid. So this is going to be due to things like vomiting. When you vomit, you're expelling the acidic content of your stomach. Alternatively, gaining too much bicarb can cause metabolic alkalosis. And this can be due to things such as hyperaldosteronism, where you have excess steroids in the body. And there are some steroids in the body that increase the kidney's retention of bicarb. And that excess bicarb gain puts us in a state of metabolic alkalosis. Another cause of metabolic alkalosis is having low potassium levels. And this could be due to excessive diuretic use. And so just like the other situations, the treatment will include treating the underlying cause. I hope this video helps. Please like, subscribe, comment, and share.